Hello and welcome to Let's Talk with NP Student, where we're keeping you updated with every aspect of your life in and out of school. I am Dr. Patrice Little, and I'm excited about what we have as far as our discussion today. We're going to talk about how nurse practitioner organizations can help shape nurse practitioner education. And joining us today is Dr. Dwayne Aline. He is the co-founder of the Capital Nurse Practitioner Group in Columbia, South Carolina. Welcome, Dr. Aline.
Hi, Dr. Little. Thank you for having me. I'm excited to be here.
I'm excited to have you. Been following you for quite some time, and I've noticed the impact that you've had not on a state level as far as with nurse practitioners and their education, but also on a national level. So let's get started. Can you tell us a little bit about your pathway from registered nurse into becoming a nurse practitioner?
Well, I did not want to be a nurse. I wanted to go into med school. However, my pathway led me to an LPN, becoming an LPN first. And then I transitioned into becoming a registered nurse. I went to Adelphi University in Garden City, New York. After I graduated, I went straight into the Air Force, where I served for about 3.5 years. And during that time in the Air Force, I was also deployed to Iraq. Shortly after I got out of the Air Force, I ended up working in the ICU as a nurse in Columbia, South Carolina. And after the first 6 months, I applied to University of South Carolina to get into their master's program for acute care nurse practitioner. So after I became an acute care nurse practitioner, I started my hospitalist position at the Dorn VA Medical Center. And then 10 years later, I obtained my doctorate, transitioned to another hospital, Prisma Health Richland, and then 3 years this will be my fourth year coming up, where I got into academia as a clinical assistant professor. So that's a short story of how I got into my current career. It's a lot more underlying issues, but I'm trying to keep it short.
Well, I thought you did a fantastic job just giving us an overview of that, because then we're able to pick from there as far as what we would like to highlight. One of the things that stood out from your story is how you started off truly from the entry level of nursing as far as those pathways as an LPN. Can you tell us a little bit about how starting there has contributed to your appreciation for the nurses that are under you when you work in the clinic?
So as I stated, I did not want to be a nurse.
I know.
Becoming an LPN
Yeah.
truly made me fall in love with nursing. I saw the value in it, and I saw the endless possibilities. I'm the type of person likes complex critical thinking. So nursing gives you the opportunity to do that. Also, you have opportunities to work in other arenas. So when I transitioned from LPN to RN, that was one of the most exciting times in my career, because I'm always a visionary. I always kind of think about what I can do in the future, how I can impact those that I take care of. So I figured as an RN, I can do so much more, and that was so true. So transitioned from LPN to RN, and I wanted to take the next step and going to become a nurse practitioner and do a lot. So that's how that transition occurred, and realizing the potential and the impact I can make being in my current position.
And so from there, you of course had some experience in what areas as a registered nurse before you transition into acute care nurse practitioner?
So my first career start as a registered nurse was in the military. So I first started working in the clinic. I did not. I'll be honest. I did not like it because I felt like a glorified secretary. Because my job pertained of this responding to patient complaints, scheduling appointments, refilling medications. So I wanted to do better for myself. So I went to the commander and said, I'm not growing in my career. You need to move me to some place where I can grow. So they moved me to a hospital in Texas, Lackland Air Force Base, where I worked in a med surge unit. So it was a combined unit. So I got to see medical patients and surgical patients. So I got the best of both worlds. So that was good. And then I got deployed in Iraq and learned how to work with this bare bones in a tent. and barely having any supplies and doing more out the scope, practicing a little bit out of the scope of an RN. And then when I got back, I got my real deal in the critical care. When I applied for ICU position, they fast tracked me through orientation because I advanced quickly through the training. So I didn't have to go through any formal orientation. I was able to start rather quickly and start working as an ICU nurse. So that's how my pathway started.
That's a good pathway too. You should definitely look into writing a book about that one day because it's so unique.
Mhm.
So I feel like it'll be very encouraging to individuals. Did you have any mentors along the way? Because I'm getting ready to transition to talk about the nurse practitioner group you found and wanted to know a bit more about the mentorship, like, as far as the support system.
So I did not really have any true mentors, and yeah, and you have me thinking about it because I did not know about the importance of mentorship when I went through starting my nursing career. So I kind of fended for myself. I myself was my own mentor. Of course, God is my mentor, so my faith kind of helped me through. But I didn't have somebody that I could call upon or say, "Hey, what should I do?" I would say my mother probably be my mentor, but she was a nurse, so if I had to name a mentor, it's truly my mother kind of pushed me through and said, "You should be a nurse. Maybe you should do this." And then I'm kind of driven to do things, so that's what I did.
So this is a great place for us to segue into the Capital Nurse Practitioner Group. I really like what you're doing and as far as how you're giving back. Can you tell us a little bit about the story of behind the development of the group?
Okay, so when I graduated from the University of South Carolina in 2008, there was a small group of us because the acute care program was very small, so there's only a small group of us. So there was about six of us. I went to a conference in Myrtle Beach, South Carolina, and I met one of my former classmates. And she came up to me, and that's why I'm the co-founder. She came up to me and said, "Hey, do you want to form a group?" And me not thinking anything of it, I said, "Yeah, let's form this nurse practitioner group." I didn't think it was a big deal. There's actually a revival of an old group that kind of fell apart. So we kind of said, let's do this. And so we got together and planned. Our first meeting was at a Mexican restaurant that's no longer open. There's only three of us in a little room that started. But after we started becoming more innovative and creating stuff and reaching out and networking and pulling in more members, we started to blow up. So that's how it started, just from a meeting at a conference. And we just started formulating ideas and started using technology and innovative ideas, and that's how we kind of got to where we are now.
And so one of the going to have a little bit feedback issues. So for okay, good. So one of the reasons why I ask is because that has been a gap in NP education, and that's why we're here to have the conversation today. We're really talking about how can those nurse practitioner organizations and groups, how can they shape the NP education? There's so many ways that it could be improved, so we can ultimately provide quality care to our community. Can you tell us a little bit about as far as what you've seen or just how the impact that you guys had so far when it comes to your in Colombia?
So one of the things that we started focus on in the past year or two are students. In the early development of Capital Nurse Practitioner Group, the makeup of the membership was about 80% students and only about 30% practicing NPs, but that started to shift. And now we're up to only about 10% students and 90% practicing NPs. And we always get emails from students, "Oh, I need help with how do I do a contract? I just graduated. How do I interview? How do I what questions should I ask? What's considered a good salary, or I have trouble getting a preceptor. I need some help." So we kind of recognize that need for students, and so we kind of shifted our focus and started to focus on students. So we noticed a lot of gaps in education. A lot of students are unprepared for certain things like contract negotiation, certain skills that they don't get to spend a lot of time, like EKG interpretation. They don't get a lot to spend the time with skills like suturing or IND and stuff like that. They also get anxious about taking a test. So even though they get some training and formal training in their programs, they don't get some of them need some extra help or some encouragement. So we kind of focus on that, those things. And also we've been coordinating with companies and business that focus on educating nurse practitioners, new grads, and NP students. And so we kind of been working with them and to develop programs and collaborate on events to help those students out. So we recognize those gaps. We've been focusing on students and also preceptorship. We've been working with, encouraging networking. That's why we have the meetings. And when students look for preceptors, we know it's very difficult just to get a preceptor. So we tell them network. The best way to get a preceptor is network, even though the students, the nurse practitioner you may meet may not be able to precept you. They may know somebody that knows somebody and get you connected. So it's all about connections and networking to help these students.
Well said. It is mainly about the connection, and it's important to reinforce that that connection starts just before they get into NP school, which is why that it's important, or it's a benefit to become a part of an organization, a state organization early. The earlier you get involved, the earlier you're connected, and then the earlier you're able to utilize the resources. So I really love what you guys are doing. I wanted to change gears here a little bit because there's been so much changes in nurse practitioner education over the years, and of course now we have more technology that's involved. But wanted to know a little bit more about how you feel your organization could help shape the the direction, or the shape NP education in the direction it's going now, as in more so now we have more AI tools, and it's just a little bit different than it was when we were in school.
Yeah, so I'm an educator as well. So so I can see how the AI tools can,
Oops. Oops, pardon me. Yes, I
right?
can see you now.
So so I see how the AI tools can impact education. So we have to make some of the teaching guidelines a little bit more comprehensive, so they won't be just straight memorization. Also, tools can be actually helpful, especially since COVID, we had to utilize the virtual option for training. So we utilize the virtual option a lot when it comes to training, when it comes to having webinars. We connected with somebody that has webinars with those gaps that like EKG training, um, contract negotiation, those things that I mentioned previously. So utilizing um, virtual options, that way the student doesn't have to be in the exact location. Also, student feedback response, so student responsive applications where they give a response and it kind of gives them a realistic approach to certain clinical situations. So we've kind of been working with the new technology to kind of keep up, especially with AI, because we want them to do a comprehensive approach where it's individualized, so there's not just one right answer. It's based on their thought process.
I wanted to take a minute to focus on the feedback approach, and mainly because I noticed that feedback approach has been a part of the technology that we use for CPR. Like when you have the two green lights, it lets you know that you're doing the right depth and then you're going at the right speed. Can you teach me, because I'm learning about the new feedback approach with MP education? Can you teach me a little bit about how that is done, how it's set up?
Yeah, so that would be primarily with simulation. That's why simulation is becoming a big thing and it continues to advance. They always upgrade and give more training for that, because every one of us as faculty have to be trained
Okay.
for simulation. So one of the things to provide feedback is you set up a case study. So I'll give an example. I would set up a case study. A student explains what they plan to do. And based on what they do, we have the mannequin that's primarily being used respond appropriately. For instance, if they have a patient that has low blood pressure and they give a vasopressive agent like Levophed, the blood pressure would improve. Or if they give medication for a certain diagnosis, like if the patient has sepsis and they give antibiotics appropriately, then the patient vital signs will improve. However, we do the opposite if they give the wrong medicine. So if they're supposed to treat sepsis and they go down the respiratory failure pathway, the patient will not respond and end up crashing. So that's our good feedback response. And then we do something called PAIL, where we go back and find out how they feel about the overall scenario, and we kind of give positive feedback as we go along. So that works.
Okay. I like that. Okay. So it's just more advanced way of simulation, as you mentioned.
Mm-hmm.
So this is a good place to move into the event that's coming up.
Mm-hmm.
You're having the MP Student Symposium on September 9th from, I believe, 8 a.m. to 9 p.m. and 8 a.m. to 5 p.m. And can you tell us a little bit more about what attendees can expect from attending the symposium?
Okay, and we have a robust group of speakers, and I feel very honored that those that decided to agree to present, because we started our first inaugural event was last year. We only had a half a day,
Okay.
where we just had speakers. Our goal for this year was to do half a day of speaking topics, and then the second half of the day is skills. So the first half of the day, you'll be able to learn about NP students. We'll be able to learn study strategies in school. We have an expert named Emily Lane. She has a program for NP students. She's connected with a lot of people with SOAP note writing. She does a lot of primary care tools for people to be able to write notes. So, and she does a lot of strategies for test taking skills. So she'll be there and kind of give an overview of test taking strategies, because that's one of the biggest things I see with my students is anxiety over test taking strategies, especially when there's a overwhelming amount of information. Next, we have Latrina Walden, she's one of the premier exam prep company owners. She's an entrepreneur. She has a variety of test prep courses for the credentialing exam. She just recently started the acute care credentialing exam programs. She also has a bunch of webinars on our website for contract negotiations, and that's what she'll be talking about. And also, we will be talking about building a business, because a lot of NPs, don't want to work under institution where they're restricted. So we have a young lady named Tasha McCain Curry. She formed her own business and is doing well. So she has a primary care business, and she knows the ins and out and the down and dirty about that. So that will be good information as well for those interested into starting their business. And then after lunch, during lunch, we'll have lunch, and before lunch, actually, we'll be talking about health policy, because one of the things I noticed, nurse practitioners, brand new nurse practitioners and nurse practitioner students do not know about health policy. Health policy will impact the way you practice, your ability to form a practice, your ability to get a job. So you should be involved early. So Dr. Cheryl Mitchell with the University of South Carolina will be giving information about health policy and how legislation will impact your ability to perform as a nurse practitioner. And then after lunch, we go into the skills fair, where we'll have Dr. Lori Cook. So teach suturing techniques for those that want to work in the um, family practice setting, and also incision and drainage. And then we have a cardiovascular nurse practitioner, Janet Kubas, who's been in cardiovascular and critical care for quite some time. And she'll kind of go over the basics of EKG interpretation. So no matter where you are, what practice you're in, there may be a time where you have to look at EKG and interpret it. So this will be very useful information for anybody that attends. So we welcome anyone. Tell everyone, spread the word, because this will be very useful. I guarantee this is the most robust event we had yet.
It is very robust, because everything you mentioned are the essential to nurse practitioner practice. And I like that you're letting them know that in the beginning of their education, because that's where the empowerment begins and where they start building their confidence. And
Mhm.
for those who are just tuning in, Dr. Lean is talking about the 2023 MP Student Symposium that will be held in Columbia, South Carolina on September 9th. And here is the QR code for those who want to scan and be able to visit the site. Dr. Lean, can you tell us the website as well so for them to visit?
So the website was an easy website, www.capitalnp.com. You'll see a drop down that after a few seconds, let's wait, and you'll see a drop down that leads you right to the symposium registration, and that gives you all the information you need. It gives you the covers the agenda, so everything you need to know about the information. And if you have any additional questions, you can email us at info@capitalnp.com.
Okay. Well, this is exciting. I'm so happy that you were able to take the time to join us today. And I wanted to close off by asking you one of the questions that I ask every guest. And
Mhm.
it's a statement. And then I just want you to complete it. And it's, if I only knew then what I know now, I would have.
So if I only knew then what I knew now, I would have started networking and joining organizations much earlier because I'm seeing the benefits of it now. I just started doing that since COVID, and I've met a lot of people. I have a lot of friends wherever I go. People recognize me and thank me for being inspirational, even those that inspired me. So the benefits of networking. That's why I kind of drive in or tell my new students or nurses start networking early because the benefits of networking, you never know who you meet. It may change your path or your pathway to your career goals. I have changed my career goals based on just people I've met and been influenced by. So that's why I would have been networked much earlier.
And I couldn't agree with you more, and wanted to know that you wanted to let you know you've also been inspiring to me, especially now that I'm learning more about your story, because you never know where people come from. And when you share your story, people are actually able to see themselves in you. So I totally get that part with nursing because it's the same thing
Appreciate
with
it.
me. I was actually going to go to medical school, and we could talk about that off camera. But yes, I hope everyone who's tuning in have found this information valuable. I felt it was very insightful. Do not forget to look into the 2023 MP Student Symposium that will be hosted by the Capital Nurse Practitioner Group in
September
Columbia,
9th.
pardon, September 9th.
Yeah.
Yes, and you have to show that QR code again. That way they can also be familiar with the image it looks like on the website. So that's the image that you see when you go to the website. And is there anything else you'd like to add before we close out, Dr. Aline?
No, just thank you for this opportunity and I think that's a good thing when you look out for NP students. So I like to give kudos to you, Dr.
Oh,
Little.
thank you.
Appreciate what you have here, and I just hope you continue to show support for MP students, especially at this time because a lot of them are nervous, they're uncertain. So it's people like you and myself trying to look out for them and let them know that we have someone that has their back is very important. So I think what we're doing is very
Absolutely.
special.
Thank you. And thank you, everyone, for tuning in with MP Student, where we keep you updated with every aspect of your life in and out of school. And of course, that includes that networking component. And be sure to follow us at MP Student. And Dr. Aline, where can they follow you?
You can follow Capital MP. We're on Instagram and we are on Twitter. I think yeah, and LinkedIn, our business page, and we have a regular page. So you can follow us on any of those social media sites to keep up to date. Also, you can go to our webpage, sign up for notifications, email notifications, text message notifications. If you want to, stay abreast of our upcoming topics, we always send email messages. And if you have any questions about membership, just email us at info@capitalmp.com.
And you